Well, every 20 minutes, another man will die from prostate cancer. For patients with aggressive disease, surgery or radiation treatment is appropriate and may be life-saving. For patients who have lower risk prostate cancer, there may be other options worth looking into. I'm joined this morning by Dr. Jeremy Lieb and Al Piazza to tell us more. Gentlemen, thank you so much for joining me this morning.
Thanks for having us.
So, Doctor, I'd like to start with you. Tell us about the different tests that are out there for men.
So prostate cancer is a very common diagnosis. 1 in 7 men in America are found to have prostate cancer. Well, the PSA test is a blood test that primary care doctors will usually order with your annual physical exam. If the prostate blood test is a little elevated, that may lead to a referral to a urologist like me. And if you need to have biopsies done, there's a chance that it could find prostate cancer. But surprisingly, many men are better off living with prostate cancer and going on an active surveillance of monitoring their cancer without any intervention like surgery or radiation. And there's some new genetic tests that have been really helpful to identify these men and protect them from having unnecessary treatment.
Well, that's definitely good news this morning. Doctor, tell us, who's a perfect candidate for this genetic testing?
So the genetic testing is based on having the biopsy and the diagnosis of prostate cancer. So it's not for men to determine whether you're at risk of having cancer. That's really up to your primary care doctor doing exams and PSA. But the genetic testing, the Prolaris test, is run on the actual biopsy tissue. So there's no additional procedures needed. We take the prostate cancer tissue and send it to the lab for analysis.
So, Al, you've actually had this Prolaris testing done yourself. So, doctor, what I want to know is, how did his testing results kind of guide your treatment options for Al?
So an analogy I use is like NASCAR. I love NASCAR. If you have 8 cars lined up on a track and you had to try to figure out which one was going to finish the race first, and all you were allowed to do is look at the outside, so the color of the car, the windows, the wheels, you're not getting all the information. That's what we do when we look at the prostate cancer cells. What genetic testing like Prolaris is doing is you're lifting up the hood and looking at the engine to get an idea of the horsepower and the speed that this car will have. It sounds like a crazy analogy, but in a lot of ways, prostate cancer is very similar. The idea is determining which are your fast-acting bad cancers and treating those aggressively. But for many men who are diagnosed with a low or low-middle risk prostate cancer, they're much better off monitoring the disease and living with it. It's a scary concept, but the alternatives of surgery or radiation can offer a lot of side effects.
Well, absolutely. So, Al, let's talk to you. As somebody who is diagnosed with prostate cancer, tell us some of the medical decisions that you faced early on that were kind of difficult.
Well, when I first found out that I had the prostate cancer, it was absolutely devastating. It took me to my knees. I was 70 years old. I had just finally retired, looking forward to a future with my wife, my grandkids. And when I found out I had the cancer, all of that came to a screeching halt. When I went to my primary physician, he determined that my PSA level was elevated and referred me to a urologist. Fortunately for me, he referred me to Dr. Lieb. When I went in there and he did the biopsy and told me I had the prostate cancer, I was devastated. My first reaction was naturally to take it out of my body, cut it out. I don't want anything to do with this. I just want to get rid of it. And then he offered me the alternative of, let's take it one step further. We have this Prolaris test that will give me some idea as to what the chance of me dying within a 10-year time frame. And when he came back with the results that mine was low grade, only a 3% chance, it was a whole difference in my life. I didn't have to go to the surgery. We could just do active surveillance where we watched it and checked it every 3 to 4 times a year. It was a game changer for me. It was just unbelievable.
Well, absolutely, and how relieving it is to hear that there are other options than having your prostate removed or surgery. So, doctor, tell us some of the other treatment alternatives we do have.
Well, a lot of men undergo treatment with surgery or radiation for prostate cancer, and that's absolutely appropriate for a higher risk patient that would really benefit from those treatments. But surgery carries risks of needing to wear a diaper, of issues in the bedroom. Radiation has other side effects and risks associated with it. So for patients that need treatment, that's a great option. But the reality is many men who are diagnosed have a lower risk cancer, and so avoiding those side effects and risks becomes a really important part of your decision making. Genetic tests like this Prolaris test have been helpful to me because prostate cancer usually is a marathon, not a sprint. So knowing what the 10-year risk within 10 years of this man dying of prostate cancer can really change the whole perspective as far as how you're looking at your disease and treatment in the future.
Absolutely. Doctor, where can we go for more information about this Prolaris testing?
They have a website. It's Prolaris, Prolaris.com.
Awesome. You guys, I want to thank you so much for joining me. Al, thank you so much for sharing your personal story with us this morning.
Very welcome.
Thanks for having us.
Now don't go anywhere. The Morning Blend will be right back.